class, welcome back again. We are now at chapter 38, assisting with a general physical examination. This is something that is very important for you guys, as you being in the doctor's office are going to be doing this a lot. And when I say a lot, I mean a lot. Especially depending on what office you go to, you may do this a little more than others. Well, let's just get into it. All right, some of our learning outcomes for this chapter is the purpose of a general physical examination, your role as a medical assistant in the physical examination, any type of safety precautions that are used during a general physical examination, and how to carry out the steps necessary to prepare the patient for an examination. You're also going to talk about the different positionings that we use in a doctor's office when preparing our patients for certain examinations. We're going to talk about different techniques in assisting your patients, and we're going to talk about the 6 examination methods and the components of a physical examination, and follow-up steps after a patient comes in for a general physical examination. Okay, so let's talk a little bit about the purpose of a general physical examination. So most of the time, this is to confirm a patient's health status. The physicians usually perform an examination on a routine basis. A lot of times it's done once a year. Hopefully every one of you all have actually been to the doctor at least once a year, because that's the whole point of a general physical examination. You want to make sure that your health is the way it needs to be, and if there is something that's wrong, you can go ahead and get it fixed now rather than wait until later. Which, of course, you guys know that there are a lot of people who do not go to the doctor on a regular basis, at least once a year, and normally our problem children are normally men. Believe it or not, it is men that are our problem children. Now, sometimes people may come in to have an exam done just to fulfill a requirement before an individual can actually start school. So you'll have a lot of children that are coming in, or even for college coming in, needing to get an examination. Sometimes you have patients that are come in when they're going to start a new job, because they got to have certain physicals for a new job because it's a requirement. Another reason why people would come in is if they are going to start a new exercise program. They want to make sure that they're able to do all of the things that is required of them to begin that exercise program. Now, a clinical diagnosis is made based on signs and symptoms. So a sign is an objective information that is seen by the practitioner or proven through testing. Now, a symptom is subjective information supplied by the patient. And remember, you kind of know a little bit about that just because when we do our triage and we ask people, what is your reasoning for coming into the office? So we normally get those symptoms that the patient is given that we get from the patient, because they're the one that's able to tell us what those symptoms are. Because a lot of times we can't actually know what the symptoms are unless the patient tell us. Now, when it comes to signs and symptoms, they are assessed to determine the correct diagnosis of the patient. We do have what we call a differential diagnosis. Now, a differential diagnosis is when you have 2 or more diagnoses that could possibly be possible for that patient. So the prognosis is a forecast of the problem course. The probable cause and outcomes of the disorder and the prospects for recovery. So that is what signs, symptoms, differential diagnosis, and prognosis mean. All right, so let's look at the role of the medical assistant. So you as the medical assistant, it is to provide comfort and safety to your patient and competent assistance to the physician during the general physical examination. So it's important that you, as a medical assistant, make sure that your patient is comfortable in their role. So say that you are doing a OB visit with your physician. Well, you want to make sure that that patient is comfortable. So you're kind of watching your patient while also assisting your physician and watching your physician at the same time, to be sure that your patient is not uncomfortable in what's going on. And if you happen to see their face smirk up, because sometimes your patient won't say anything, so sometimes you will have to kind of watch their face and see if they're smirking or making a cringe face, and that lets you know that they are in pain at that time. So if they are, you want to make sure that you comfort them and ask them, are you okay? Do you need anything? And then once you say that, your physician might say something to help comfort the patient. But most of the time, the physician is normally like letting the patient know step by step what they're actually are doing. And letting them know that it could be a little painful, but they'll also tell them to kind of like relax a little bit. They try to coach them through the process, which is always good. Now, safety precautions. Safety precautions for a general physical examination are outlined by the Department of Labor's Occupational Safety and Health Organization. You all know that as OSHA, okay? And it's also outlined by the Department of Health and Human Services, Centers for Disease Control and Prevention, which you guys pretty much know that as the CDC. Now, safety measures protect the physician, the patient, and other staff members from disease transmission. Now, how do we go about doing that? If you said PPE, that is accurate. Wearing your PPE appropriately and utilizing it. And depending on what type of facility you are in, there is a possibility that you may have to put on different things depending on what you come in contact with as far as your safety precautions. And we should be talking about that in just a moment. All right, let's move forward. Oh, no, matter of fact, let me stop right here. I want you guys to flip over to a table in your book is 38-1. If you have the book, it's actually on page 789. I want you to take a look at that, because to me, I feel like this falls in safety precautions, but in your book, I think they don't really talk about it until they're looking at physical preparation. But to me, I want you guys to pay attention to this chart, because we have actually talked about this in the previous quarter a little bit. But as you can see, like when we're dealing with different types of infections, remember I was telling you guys about the precaution type, whether it's contact, airborne, droplet. These are something that you want to be sure that you put on the right attire. So just for a person that might have an abscess, that is called contact. So that's the precaution type. So as you see, it says the appropriate PPE is just gloves and gown. Now, a person that has AIDS, that's considered a standard precaution, because they're not necessarily having to be on a contact, airborne, or droplet precaution. It's standard because there's nothing that you're going to actually get from a patient that has AIDS unless you are exposed to their blood or their bodily fluids. But let's look at anthrax or chickenpox. As you can see there, chickenpox and anthrax are both airborne and contact precaution. So that means that you have to wear a respirator or mask and gloves and gown. Now, they have here respirator or mask and goggles and gloves. Well, to me, in my instances of being out there, especially for like anthrax, I would probably want to put on a respirator. I don't know about just wearing a regular mask, because I don't want to inhale, because there's a whole point of wearing the respirator, or what they call an N95 mask, because the N95 mask is supposed to keep things from traveling through the mask. Whereas, and it's also supposed to filter what the breathing that comes through. But for a regular mask, I don't see there being really a filter there. I'm just not sure about that. But what I do know is if I put on a regular mask, I know that that's going to protect me from, if a person just has a regular cold, you know, or I'm doing an examination, if something happens to pop up on my face, it's going to protect my face. But as far as keeping me from getting anthrax or chickenpox, I'm really not sure about that, because normally in the hospital, when we put a person on airborne precautions, we normally are putting on an N95 mask. And I feel like there's a reason behind that, because an N95 mask has to be fitted on your face. It has to be fitted, and it has to be the right size, because even through a regular mask, if you were to put on a regular mask and go through the fitting process of an N95 mask, I believe that you would be able to smell or taste the spray that they use to fit you for the N95 mask. So I'm just not sure about just wearing a regular mask for this. I would have to say I would go with an N95 mask. That's just my take on it. You may think differently, but that's just my take on it. But if you look down at herpes zoster, shingles is just a contact only precaution. So it tells you that you need to wear gloves, gown, and it says, note, individuals who have not had chickenpox should avoid contact with patients with shingles. Most of the time when a patient has shingles, we tend to tell patients to not go around young children, especially newborn babies, young babies, and different things like that, because they will possibly spread over the shingles virus to the kids, cause them to get chickenpox. So they're not supposed to really go around younger kids. Now let's look at droplet precaution. Remember we talked about influenza being droplet precaution last quarter, which tells you have to wear a mask, goggles, when working with within 3 feet of patient. Because remember, when a person coughs or sneezes, the sneeze or cough travels 3 feet out. So you want to make sure that if a person is sick, that you do have on this, because if you're working within 3 feet of that patient, you're bound to get it if you don't have it. Now you see measles are airborne only. It says mask and goggles or respirator. Like again, me myself, N95. So those are some kind of examples of the different ones. But as you can see down at the bottom, tuberculosis is airborne, mask and goggles or respirator, as they say. So this is an example of this chart of different type of precautions, what PPE to wear. So I would always pay attention to that and make sure that you're following the protocol. All right, preparing the patient for an examination. Patient modesty and privacy concerns should be respected at all times. The practice of having chaperones available on a consistent basis for patient examinations is always recommended. The goal is to respect the patient's dignity and to make positive efforts to secure a comfortable and considerate atmosphere for the patient. You want to make sure that you provide your patient with a gown. You want to make sure you have a private facility for them to get undressed. You also want them to use a drape. The drape are normally something they can drape across their legs or across their chest and different things like that. And clear explanations on various components of the physical examination is always important. So you want to also make sure that you ensure a policy is in place for patients to request a chaperone of the same sex. This is something that is should always be available in the different doctor's offices. So if there is a female that come in for an examination and the physician is male, but the person that's working with them that day is a male, the female should be able to say, I'm sorry, but I would like to have a female chaperone to come into the room. And there should be a female chaperone there for them to be able to be chaperoned and not have to be in a room with two men necessarily. But you will have those patients that that do not care. Okay. Now, when it comes to also preparing patients for any type of physical examination, especially when the physician is going to be working in the cervix area or vaginal area, you want to make sure that you offer the patient to go use the restroom. You also want to always offer the patient to help with getting undressed or getting draped with a drape or whatnot. So always make sure that you assist your patient when needed. All right, so let's look at positioning and draping. All right, so symmetrical body is less prone to injury because compensation for a weaker muscle group may overburden the system. Now, as you can see here on your screen, there are diagrams that illustrate positions that may be used during a general physical examination. So, as you can see, these positions include sitting. And sitting is usually where the physician is able to examine the patient's head, their neck, their chest, their heart, the back, and the arms. And this also allows for them to evaluate the patient's ability to fully expand the lungs. Then the physician may also check the upper body parts just to be sure that it is symmetry, which is the degree to which one side is the same as the other. So in the sitting position, the person normally has a drape, as you can see on the screen, that is across the patient's lap. For both men and women. If it's for women, sometimes they may have on a gown, or they may have the drape come up across their chest and lap. But most of the time, doesn't matter whether you're a man or a woman, it is laying across the woman's lap, just depending on what type of examination they are having. And in most cases, if we have a woman that's going to have a couple of different examinations, and the doctor may start out in a sitting position so they can examine the head, neck, chest, heart, back, and arms, and their lungs, and check for the symmetry. But then they may have them lie down, which we'll talk about that in just a minute, in the lithotomy position to go further with their examination. The other one is supine, or where you may hear it called recumbent. That's where the patient is lying face up. The doctor is able to examine their head, neck, chest, heart, abdomen, arms, and legs. And most of the time, the drape is from the neck or underneath the arms down to the patient's feet. Now, when we talk about supine, that is meaning lying down face up, and recumbent just means lying down. So both terms are used to basically describe this whole position here. The other thing is that I wanted to say about this is that being a person that is pregnant, far along in their pregnancy, or a person that is obese may not feel comfortable in this particular position. So you have to be mindful of that, because they can become shortened of breath. All right. So your next position you have is dorsal recumbent. Dorsal recumbent is just where the patient lies face up, with the back supporting all the weight. And dorsal refers to the back. Okay, that's what dorsal recumbent means. So this position is basically the same as the supine position. Only difference is the patient knees are like kind of drawn up, and the feet are flat on the table. Okay, this allows the physician to examine the head, the neck, the chest, and the heart while the patient is in this particular position. When you have patients that have disabilities, this may be uncomfortable for them, and some of them it may be impossible for them to even do. Patients who are elderly or have painful disorders like arthritis or back pain may not be comfortable, or they may be comfortable, more comfortable in this position than in supine position. I know when I'm like at the doctor's office and they ask me to get in the supine position, I'm more comfortable doing the dorsal recumbent position versus the supine position, just because I'm able to bend my knees. And I feel like, and I don't have arthritis or anything, but I do have low back pain. So it's not easy for me to just lay, flat on the bed in supine position. It's like I would rather be in the dorsal recumbent position. Your other position is lithotomy. Most women, you know what lithotomy is because you can relate this more so to having a vaginal examination when you're going in for your yearly exam, because this position is used during a female genitalia exam. So the patient is lying on their back, which is normally a she, with your legs bent and your feet in stirrups. And the stirrups are normally what are attached to the exam table, but they're underneath the exam table. So you would actually have to pull those out. And sometimes your patients will need you to help them get their feet into the stirrups. And that's what we call them, is stirrups. And in order to do this, when the person is laying on their back, the doctor may do a breast examination first. So most of the time, that's the position patients are in for the supine. It could be so they can get a breast examination by the physician. But when they're through with that and they're going to do the genitalia examination, they'll have the patient slide all the way to the end. They're sliding their buttocks all the way to the end, to where you almost feel your buttocks like kind of like dangling off the table when you're at the end. And then your feet are placed into the stirrups so the physician can do the examination. The one big thing that they like for you to note inside of this position is that you don't want to leave a patient in this position longer than needed, should I say. Just because most patients are uncomfortable being in this position, and for some patients it causes an embarrassment to them. So always make sure that once the physician is done, that you go ahead and help them up. And another big thing is, in this position, you also make sure there's a drape going across their legs, because even when they put their feet up inside of the stirrups, that drape is still going across there, just kind of keeping it private for the physician to see. And you should be standing in a way to where you're able to actually see just a little bit, just to make sure the physician is only doing their job and nothing extra. Let's see. The next position you have is the Fowler's position. Now, the Fowler position is where the patient lays back on the examination table with the head is elevated at 45 degrees. This allows the physician to be able to examine the patient's head, neck, and chest area while the patient is in this position. This is a great position for patients who are experiencing shortness of breath or patients with a lower back injury. Your next position would be the prone position. This is where the patient is lying flat on the table, but they're laying face down. Okay, the patient's head is turned to one side. Most of the time, it's turned to one side only if you are not on a table that has an opening for the head. So I don't know how many of you ever went to go get a massage before, but if you go get a massage, they normally have these tables where you have your head, it sits there, but there's an opening to where you can lay with your face lying flat down. But in the doctor's offices, we normally do not have that, so that's why the patient's head has to be turned to the side. You have also the arms are placed at the side or bent at the elbows, as you can see in your picture. The physician at this point can examine the patient's back, it can examine their feet and the musculoskeletal system. This position is not suitable for a patient that is pregnant or obese or any patient that has any type of respiratory difficulties, and is most definitely not functional for an elderly patient. Now, your next position is the Sims position. Now, the Sims position lies on the left side, and then you have the patient's legs slightly bent, and the left arm is placed behind the back, so the patient's weight is rested primarily on the chest. The right knee is bent and raised toward the chest, and the right arm is bent toward the head for some support. This position we normally use for any type of anal or rectal examinations. You can also use it for perineal or certain cervical examinations. If you have a patient that has joint deformities or hip or knees, they may have some difficulty getting in this position. Now, for your knee chest, or what we call knee elbow position, this position is lying down face down on the table, and then your body is being supported by your knees and your chest. So most of the time we try to say this is more like the crawl, like get ready to crawl, so get in the crawl position. So the patient's thighs should be at a 90-degree on the table and kind of like separated. And the head, of course, will be turned to the side because the head is still laying on the table. You may have to help some patients get in this position, just because a lot of them won't get in the position correctly, so they can have the examination done. When we do examinations for this type of position, it's normally anal or perineal areas, and we also have it's kind of similar to the proctologic position, but if the patient is able to lay up there like that themselves, then we'll put them in the knee, elbow, knee, chest position. Now, those who are pregnant, obese, and elderly, they can have some difficulty getting in this position. A lot of times we do use this position for like pregnant women if their baby is breech. So this is a position that we tend to kind of get them to put them in, just so we can try to get the baby to turn. The position is the same as the knee chest position, except that the patient supports body weight with the knees and the elbows. The patient is commonly covered with a fenestrated drape, and that's because the doctor is going to leave an opening. Fenestrated just means opening inside of the drape. That's just so that they can actually only attend to the area that is being worked on. And we talked a little bit about that last quarter when y'all were doing the wound care of the patient that was bleeding, where we talked about fenestrated drapes. You also will see fenestrated drapes inside of a catheter kit, where there's just an opening there in that drape. Now, your next position is the proctologic. Most of the time you'll hear people call it a jackknife position. This position is used as an alternative to Sims or knee chest position. This is where the patient is bent at the hips at a 90-degree angle. The table does this itself. The patient does not have to actually do this. So we do have tables that actually work for this. So the patient would just basically lie down on the table, and then the table itself will actually bend in the 90-degree angle, so that they can actually make sure that the patient is able to be propped in the way that they need them to complete the procedure. And here, yes, they do still use a fenestrated drape as well. Now, you do have some another position that they don't show on your screen. We call it Trendelenburg. This is where we can actually trend the bed either at the foot or at the head. Most of the time in the hospital, we tend to use the Trendelenburg to like assist patients that have slid down in bed. So if they slid down in bed to where they're almost at the foot of the bed, we can trend the bed to where the head goes down and the feet go up. And we're able to actually utilize that and gravity to pull the patient back up to the top of the bed. If we have a patient that has moved towards the top of the bed, slid up and not down, we can trend the head of the bed up and the bottom of the bed down, and we're able to pull the patient down to where they're able to be fully in the bed completely. All right. I already talked about the positions. As you can see here, all of them are listed. So if the patient, like I said, if they is able to sit unsupported, the physician is able to examine for symmetry. Again, they're able to examine what else? The head, the neck, the chest, the heart, the back, and arms. And if they're in the recumbent position, the patient is doing what? Yes, they're lying down, and then they are draped where? From the neck or underarms down to the feet. Now, for the dorsal recumbent position, how is the patient? If you said the knees are drawn up, you are correct. And what about the lithotomy position? What's going on with the lithotomy position? The patient has her feet in the stirrups, okay? And can this be embarrassing to your patient? If you say yes, that is correct. It can be embarrassing and uncomfortable, okay? And the patient should not remain in this position longer than necessary, okay? And what do we use for patients that are in this position? A drape. A drape is used to cover the patient from the breast to the ankles. Now, what about the Fowler's position? This is where the patient is in supine, but has the head elevated at what degree? 45-degree angle, yes. And what about the Sims position? This is where the patient lies on the left side with the left leg slightly bent and the left arm placed behind the back, right? What about the prone position? Yes, this is where the patient is lying face down. What I tend to do to try to make sure that students remember the difference between supine and prone. If you look at the word supine, you see up inside of the word. So I normally say looking up, okay? That is how I remember supine. And if you look at prone, it has the word on inside of it. So I normally say on the back, okay? That's how I kind of remember it. I mean, you can find your own way of remembering it, but that's my way of remembering it. But in the prone position, the patient is lying face up. This is unsuitable for what type of patients? Yes, it's unsuitable for pregnancy patients, obese patients, patients with respiratory difficulties, and also the elderly. All right, what about the knee chest position? What position is this? This is where the patient is doing what? Lying on the table face down, but they're supporting their body with their knees and the chest. And I told you a good word to remember is like the person is getting ready to do what? Crawl. That is correct. What are some of the common things that are used for this particular position, for the knee chest position? Yes, if you said it could be used for examinations of the anal or perineal areas, that is correct. All right. So what kind of drape do we use with a patient that is in this position? Yes, a fenestrated drape. You are correct. Now, what about a proctologic or a jackknife position? You can use this position as an alternate to which other positions? If you said Sims, you are correct. If you said knee chest position, you are correct. Okay. What is the reason behind why we would use this position? If you said we use this position also for anal and peritoneal, you are correct. Okay. What degree is a patient in for the proctologic examination? If you said 90 degree, you are correct. Okay. This is what a table does. It bends the patient at that 90 degree angle. And what kind of drape do we use for this patient? If you said fenestrated, you are correct. Now, Trendelenburg and reverse Trendelenburg positions, what does this do? Yes, you can elevate the feet or you can elevate the head, and you can also help you assist to pull the patient up in bed or pull them down in bed. Okay, so that means in this position, the patient is to lie in supine position. Okay, with feet elevated 15 to 30 degrees above the head when you do the Trendelenburg. And when we do reverse Trendelenburg, the patient still lies in supine with the head elevated at 15 to 30 degrees above the feet. Okay. Now, you do have some special patient considerations. Now, you do have patients from different cultures that may not be familiar with our medical examination, so they may not even know what to expect. So they may be more modest than other patients that have a greater need for privacy. So you have patients that have physical disabilities. They vary in their ability to move from place to place. So a lot of them will require the use of wheelchairs, some canes, or walkers. These patients may require extra assistance with disrobing and also transferring to and from the exam table. So you may have to help them, and also they may not be able to get in some of the positions that are necessary for the physician to do their examination. So it's always good that you guys be able to assist these patients. All right, let's look at inspection. Normally, inspection is a general and local type of inspection where you can simply just look with your eyes, but there are a multitude of tools which are also helpful, including a large range of scopes and imaging. Now, when we talk about oscillation, we're talking about listening to the body sounds. This is done almost exclusively through the use of a stethoscope. So that's what you use your stethoscope for, and what the physician uses his or her stethoscope for. Now, when a physician is palpating, this is dealing with them using their hands on the patient to like kind of press down and maneuver to see if they feel things that are supposed to be there. Like if you've ever had the physician have you lay on your back and they start pressing on your stomach, or if you had seen your kids, they press on your stomach, that's them doing palpation. Now, when you see percussion, this is where the physician is trying to determine if the sounds are what they're supposed to be. So like palpation is the pressing, on the child's stomach, and like I said, you probably seen them do that, and they're trying to look for signs of tactile sense, temperature sense, and kinesthetic sense of position and vibration. But with percussion, that's you've probably seen it where they take and press down and then they tap their hand, thump their hand, and they're trying to listen for the sound, because certain sounds indicate that everything is where it's supposed to be, and then there's certain sounds that indicates that there might be an issue in their way. You might have some swelling or some type of inflammation. So that's what they're doing that for. Now, when you're doing mensuration, this is the process of measuring. Okay, this is where they're measuring. Like you might have seen them measure the fat on a person's body by using a gonometer, or you might have them measure around your waist, around your neck, your arms, different things like that, your waist. They're looking for getting measurements to see how much fat possibly on the person's body, or how big your waist is, because certain measurements lead to certain things. So they kind of look for those stuff like that. Manipulation, which is the systemic moving of a patient's body part, just to determine if the joint range of motion is correct. So like you may be having to do that as well, where you've probably been told to do this, to stand and hold your arms out to the side, or raise your arms up by your ear, because they're trying to see if your arms are going to go at the right angle, 180 degrees. If you ever had surgery and you injured your shoulder, when you first go into the PT office, they measure where your shoulder is at that moment when you first arrive, and then they try to manipulate it a little bit by trying to move it to see if they can't get it to go further than where you have it when you come through the door, and they measure it. And then they put you through a series of exercises, and before you end your last session, they'll measure you again because they're trying to get you back to your most wanted health. And then they'll send that information to the doctor. So, and hopefully they're able to get you back to the degree in which you had when you first walked through the door. Components of a general physical examination. Most physicians begin by assessing the patient's overall appearance and the condition of the patient's skin. They also look at the patient's nails and their hair. Now, the medical assistant will have ready the basic items that the physician needs for a general physical examination. So the head and neck, those are checked for symmetry and range of motion. And then your lymph nodes are also palpated for signs of enlargement. Now, the eyes, ears, nose, and throat, which you probably heard of EENT, those are checked for any signs of diseases or any type of abnormalities. Now, the nasal mucosa, which is the lining of the nose, is a special focal point to check for any discharge, lesions, obstructions, swelling, or any type of inflammation. Now, if you take a look at the photo that you see on your screen, the photo shows some of the common instruments and supplies for a general physical examination. So you see on there, you may see the color chart on there for vision. You also see an ophthalmoscope and an otoscope, which is B and C. The first one was A, because I don't know if you're able to see my mouse circling around it, but you have B and C, which is your ophthalmoscope and your otoscope. You also have tongue blades, which is D, and then, which you probably heard them called tongue depressors. Then you have a near sight chart is laying down, and then you have a pen light laying beside it, which is F. And then you have a vaginal speculum, which is inside of the package on G. And then you have gloves, which is H. And then you have some lubricant, which is I. And then you have a stethoscope, which is J. Okay? Now, you also have some more components. Now, the use of a tongue depressor is to basically to help keep the tongue down and out of the way. It's often handy for examinations of the throat and the mouth. The patient may be asked to breathe deeply to check for signs of dizziness. And then a patient who becomes dizzy during deep breathing may be hyperventilating. So the chest is checked for shape, symmetry, and postural position. Now, you do have patients that may have some kyphosis, and kyphosis is just known for being humpback. This is commonly seen in the elderly. So you probably seen patients walking around that kind of like slumped over a little bit. So that's why your parents just always tell you, make sure you sit up, make sure you hold your shoulders back so that you don't become humpback. Most of us, if we were to do that now, because we don't really pay attention, that we tend to sit slightly humped over. But if you was to sit up right now and pull your shoulders back and sit up straight, you probably feel a little bit of resistance, and it probably feels sore because you don't realize that that's what you're actually doing, is sitting humpback. The physician will note the heart rate, the rhythm, the intensity, and the pitch. And during every general physical examination, everyone should have a complete breast examination, just to check to make sure they don't have any signs of cancer. Now, a lot of you, to believe it or not, men's breasts should also be checked for lesions or swelling, because they can also have breast cancer as well. Examinations of the abdomen like I talked about earlier, that begins with inspection and osculation, followed by percussion and palpation. The abdomen is typically divided into 4 equal parts, and you probably learned this in anatomy and physiology last quarter. They're in the quadrants. They're called quadrants. It's right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. You should have remembered that from your anatomy and physiology class. If you do not, you may want to go back and review that section that's talking about these different quadrants inside the person's stomach. And you also want to kind of remember which quadrant houses what organ. So you want to take a look at that as well. Now, your female patients may feel anxious or self-conscious in the lithotomy position, as I said earlier, because this is used to examine the genitalia. And the medical assistant, is your job to keep the patient relaxed for this portion of the exam. Men may be just as embarrassed or uncomfortable as women. Having a member of the same sex in the room as a chaperone during examination of genitalia is recommended for patient comfort and staff integrity. A digital exam of the rectum is commonly performed with a glove and lubricated finger. The physician may request that a stool sample be obtained. We talked about that last quarter, from the glove following the examination, and that is basically that occult test that we did, that a lot of y'all didn't like, but we had to do it because sometimes you may have to do this in the office. So the patient should be offered an opportunity to clean the area of excess lubricant. So you should be giving your patient some gloves. You may be, not gloves, you should be giving them some Kleenex or things like that so they can clean their area. Also, for women who had genitalial examinations, you may also want to offer them a sanitary napkin for just in case there was some slight bleeding when the physician finished. Now, the musculoskeletal system, this is an overall check of range of motion, as I talked about earlier, and strength of various muscle groups. The physician will ask a child to bend at the waist for a check for the presence of any type of scoliosis, a lateral curvature of the spine, and then your neurologic system is assessed for a function of the patient's reflexes, mental and emotional status, and sensory and motor abilities. Now, after the examination, the physician completes the examination, and then you as a medical assistant should make sure that the patient is comfortable. And if there are any additional tests and procedures required, you want to make sure you obtain them, such as blood samples or preparing the patient for a diagnostic or therapy session. The patient should be helped off the examination table and allowed to dress in private. You want to, if there's a follow-up needed, you want to make sure the patient gets the follow-up instructions and gets scheduled for any type of future visit inside or outside the office. You also want to plan for any type of help that's needed at home, and advising on any type of community assistance. Remember, we talked about that last quarter. You want to make sure that you also use your critical thinking skills, because this will be employed to fit the individual's needs of the patient. Okay? All right, this is the end of our chapter where we have talked about general physical examinations. Your job as the medical assistant. We talked about your PPE, different types of precautions, dealing with patients with different types of situations, and the different types of positions, and what type of positions the patients are using these for. We talked about disabilities in patients. We talked about the different type of examination methods. We talked about the examination components and the steps for follow-up. All right, hope you enjoyed this lesson. I will see you in class for further discussion.